During our primitive forefathers' days,
Okay.
we tend to eat stronger food, which makes your jaw grow bigger.
Okay.
But now, we eat very soft food, and that's why you see some people, their wisdom teeth will not erupt properly. You see it's partially or fully impacted, lying completely in the bone, and it may also destroy the tooth that is next to it.
Okay, welcome back to another beautiful episode of our podcast, Baby Dental Clinic podcast, where we expose information to the general public about their oral health, and then today we're going to be discussing a very exciting topic, wisdom teeth. So today, let's go straight into today's beautiful episode. I have an amazing guest today in the house, and I'm going to let her introduce herself.
Hi, I'm Nurse Mariam, a registered nurse and a registered oral health nurse. I'm from Bellevue Dental Clinic. We're going to be talking about wisdom teeth today.
So, Nurse Mariam, what is wisdom teeth?
Wisdom teeth are the third molars.
Okay.
Formed during childhood and erupt within the mouth around age 18.
Oh.
And they are normally 4 in numbers. However, some people may have less than 4 and none or none at all.
Oh.
Which means they can be genetically missing.
Wow.
Yeah.
Wow, that's amazing. So you mean the wisdom teeth don't just come out when other set of teeth are coming out, they just form and then they erupt later on when you're around 18 or thereabouts. Oh, that's
Yes.
So why are they called the wisdom teeth, please?
Because they tend to erupt late than the regular teeth in the mouth, around the age of 18 or thereabouts. So people assume by that age, you should be wise enough. So.
Oh. Wow. With this your explanation, you've actually cleared the misconception about what wisdom teeth are, because growing up, we thought when we hear that word wisdom teeth, it means you now have wisdom. When that comes out, the teeth is attached to wisdom. It's funny, really.
So and during our primitive forefathers' days,
Okay.
we tend to eat stronger food, which makes your jaw grow bigger.
Okay.
But now, we eat very soft food, and that's why you see some people, their wisdom teeth will not erupt properly. You see it's partially or fully impacted, lying completely in the bone, and it may also destroy the tooth that is next to it. So that's why we advise parents or people to come for dental consultation. We take x-rays. Yeah, so at a very tender age, because
Okay.
we take x-rays, and it's better to actually remove them when they are really, really impacted in the bone.
Okay.
And we see that they're going to destroy the tooth next to it. So we tend to remove them when they are age 14 or 15, when the tooth has not fully erupted in the mouth, and when the roots are not fully formed. It's much more easier to remove them.
Wow, that's wonderful.
And that's why you see some patients, they'll tell you they have pericoronitis.
Yeah.
So pericoronitis simply means inflammation of the tissue around the partially erupted tooth.
Okay.
That's why you see patients and people complaining of having discomfort and pain around the partially, erupted
area.
wisdom tooth.
Wow.
So, they things have discomforts, they can't eat, serious pain, so they just have to come to the clinic.
Wow. So you're advising that if parents get to bring in their kids earlier before the wisdom tooth eruption, the dentist can easily see that this is not coming out well, or this is embedded, like you said,
Yes.
or impacted and all.
Yes.
And then to avoid pericoronitis, like you said.
Yes.
Oh wow, that's amazing. So you're saying that we should always bring our kids for early consultation to avoid wisdom teeth complications, I'll say.
Yeah. Exactly.
Wow. Oh, that's amazing. Thank you so much, Nurse Mariam. So there's this question I wanted to ask. It concerns post extraction instructions. Okay, yes. So I actually learned that word from a friend. So he went to extract his wisdom teeth. Yes, I think 2 of them, and then there was this serious complication after it. And then when we went back to the dentist was saying that he did not follow the post extraction instructions. You understand? So I don't want to just say some things. I would like to hear from you what these instructions are, and then why we should follow them or how we should go about them.
Okay, so usually after extraction, we'll give our patients post-extraction instruction.
Okay.
Like before they even leave the clinic, we'll tell them immediately to continue to swallow their saliva. They don't spit out,
Okay.
and that's to prevent bleeding.
Okay.
Yeah, you have to keep on swallowing your saliva.
Okay.
Prevent bleeding from the extraction circuit.
Okay.
And we tell patients not to take hot food
Okay.
after the extraction, because during the extraction, we'll give anesthesia,
Okay.
and then the mouth and the tongue becomes numb.
Whoa.
So when patient takes hot food, they won't feel it.
Wow.
Right? And they may hurt themselves. So we tell patients not to take hot food
Wow.
for that day. Yeah.
Okay.
So they take cold food. We tell patients not to take grainy food, no
Okay.
smoking, no taking of
Alcohol.
yeah, no making use of straw. Yeah. So
Wow. Wow.
and then, we place patients on pain relief after extraction and antibiotics.
Okay.
Then we tell them to do warm saline mouthwash. We used to
Warm saline mouthwash. Okay.
to promote healing and to prevent infection from the extraction circuits.
Wow. Okay. Wow. This is like a lot. If I want to do a recap, you said first they should swallow their saliva, and then they shouldn't make use of straw. They shouldn't eat grainy foods. They shouldn't take something or like very hot or hot rather anything hot. Yes.
Exactly.
Okay. Because of the anesthesia, it doesn't actually wear out. Okay. And then you mentioned that
I'm sorry to interrupt too. We tell patient not to eat immediately.
not to eat immediately.
Yeah, like after extraction.
Okay.
Tell patient to wait for a while for the injection, the anesthesia to wear off
To wear off.
before take, because they won't be able to control their tongue as well.
Wow.
And then they may aspirate the food. So,
Wow. So that means that person has to eat before the extraction, or because me, I can be very hungry
we definitely we tell patients to eat before extraction.
before the extraction. Okay, so then after the extraction, you don't eat immediately. Okay. Then what about brushing? Can I brush that evening or the next day?
No, the next day preferably.
Or okay. Wow. That's really nice. Thank you so much, that's Mariam. So I guess maybe my friend missed one of these instructions. Maybe that's why.
We have patients that, like, even when you give them post extraction instructions, they don't stick to it, and then they come down with complications, dry socket.
Yeah. Really, the complication was really bad, but we were able to the dentist was able to help us handle it aftermath. So he's actually good now. Yes. So because of this show, I tend to remember what happened the last time. So Nurse Mariam, the next thing I would like you to tell us more about is scaling and polishing. Okay. Yeah. So because scaling to me sounds like a different thing, and polishing sounds different. So, but when I say I want the cleaning, most people will tell me what I need is scaling and polishing. So I would want you to explain what these two terms are.
Basically, it's actually the same procedure.
Okay.
Right. Yes, it's interlinked. So scaling is simply, making use of dental instruments. Like we have a special dental instruments equipment that we use for scaling.
Okay.
And like ultrasonic scaler, we call it ultrasonic scaler.
Ultrasonic scaler.
Yeah, or a manual scaler.
Okay.
To remove the calculus, like the deposits that are formed
on it.
And polishing is simply, it's like brushing actually.
Okay.
So like polishing with a special dental brush.
Okay.
With a paste and some other stuff.
So that exercise leaves my mouth fresh and clean. Okay. So what's the edge of scaling and polishing? Like, why is it needed when I can brush my teeth?
Honestly, even me as a person, as a dental nurse, I still do my professional cleaning.
Okay.
I still do scaling and polishing because you can't remove those things with your toothbrush. I mean the calculus.
Okay.
Yes, because they are very, very strong. They can only be removed by a dental professional.
Okay.
So your toothbrush cannot get them out.
Okay. That's amazing. So that's Mariam, like, how often do we need this scaling and polishing?
Just twice in a year. We recommend every 6 months.
Okay. That means once in every 6 months.
Yeah.
Okay, so I'll just call any dentist or...
Yeah, you just book an appointment and then...
Okay. So
Just make it like your routine. Once in 6 months,
I just go and see my dentist.
exactly, you
Yes.
can do it, then you go for it.
Okay, so but when you were explaining what scaling was, you point out one of the benefits. You said because there are places that our toothbrushes can't take out some stubborn plaques that are very strong. So
Calculus.
that's why we need calculus rather. So that's why we need professional scaling. So
Yes.
can you maybe highlight maybe a few more benefits or a few more reasons why we need scaling and polishing?
Yeah, basically good for hygiene, it prevents bad breath because
Yeah.
can cause calculus can also cause bad breath.
Oh,
And
okay.
yes, so prevents gum infection.
So Nurse Mariam, is it good to have dental implants? And why would you recommend dental implants? And what are even dental implants?
Okay, yeah, dental implants are, they're artificial tooth actually.
Okay.
Yeah, they are fixed
Okay.
in the bone, and then they're like artificial roots. Like a normal tooth, like a natural tooth, has a crown and then a root.
Roots.
So
Okay.
dental implants are also like that. They have the artificial roots embedded, like surgically embedded in the bone
Okay.
with the crown
On top of it.
on top.
Wow.
Yeah, so and it's fixed, unlike dentures that are removable.
Okay.
So yeah, that's
Wow.
dental implants for you.
So it's very, very okay to use dental implants when you have
Yeah,
missing
very
teeth. Okay. So what are the difference between teeth whitening and scaling and polishing?
Yeah, I would say scaling and polishing is healthy.
Is healthy?
Yeah, is like you should do it actually,
Yeah.
to keep your teeth healthy. While teeth whitening is cosmetic.
Okay.
Yeah, we have people that don't like the color of their teeth, the appearance of their teeth, and like people that have stains,
Yeah.
teeth discoloration, and they just want to like change the appearance of their teeth. So they just go for teeth whitening just to brighten and whiten up their teeth.
Okay. So teeth whitening is like improving the brightness or the color of your teeth
Exactly.
from one place to another. Or
Yeah.
okay. So, but how is teeth whitening done?
We have different types of teeth whitening to start with. We have in office and then we have take on. The one
Okay.
we don't just explain how to do it. We give you your home kit, take home
Okay.
kit, and then you do it yourself. And then we have the one we do like in office. We do in the dental clinic with the use of laser lights.
Okay.
Yeah, so
Wow. So if I don't want to do the one in your office, there are things you give to me, and when I go to my house, I'll brighten my teeth for. Oh, that's
tell you how to control it.
Oh, that's nice. Thank you so much, Nurse Mariam. It's nice to have you once more again in the show. Honestly, me personally, I've actually learned a lot from this little time we spent together. You've really helped to improve my knowledge about how to take care of my mouth and then improve my oral health hygiene. And viewers, thank you so much for staying with us. I would love you to like this post or subscribe on our channel, and then make sure you share this with your friends and your family so they can also learn more about their oral health. See you in the next episode. Bye.